Breaking news from Johnson & Johnson, the company announcing new results from its booster trials, and the report shows a second shot of its vaccine dramatically increases protection for the millions of Americans who got the J&J shot. This is all happening as they have been waiting for the news. ABC's Eva Pilgrim has more.
This morning, Johnson & Johnson out with new data saying that adding a second shot for its one-dose vaccine does help boost immune response, potentially paving the way for an additional shot for the 14 million plus people who got that vaccine.
This is very good news. This shows that a second shot of the J&J vaccine really substantially improves protection.
J&J saying its vaccine is still working well to prevent hospitalizations, but new data shows that 2 shots given 2 months apart resulted in 94% protection against symptomatic disease, almost identical to peak effectiveness for Moderna and Pfizer. However, earlier data finding that waiting 6 months after the first dose provided even higher antibody levels.
These data still need to be reviewed by the regulatory authorities, and the ultimate deployment of J&J boosters remains to be determined. But what we know now is much more science.
Millions of Americans who got the Pfizer vaccine could get booster shots starting by the end of the week if the FDA and CDC sign off on recommending boosters 6 months after their second shot for high priority groups, meaning those 65 and older, those at high risk of severe disease, and frontline workers like healthcare professionals and teachers who are at higher risk of exposure. On Monday, the U.S. coronavirus death toll surpassing a grim milestone, more than that of the 1918 flu pandemic.
1, 2, 3.
Now, after Pfizer announced a decreased dose of their vaccine is safe and effective for children ages 5 through 11. It will apply for authorization for that age group starting at the end of the month. If that process moves like it did for the older groups, there could be shots in arms for millions of children in elementary school by Halloween.
And it's important to know now that vaccines are widely available. Kaiser reporting that most private insurers have stopped waiving those out-of-pocket costs for treating COVID. Even more are supposed to make that move by the end of October. Kira?
All right, Eva Pilgrim, thank you so much. Well, let's bring in Chief Innovation Officer at Boston Children's Hospital and ABC News medical contributor for more on this breaking Johnson & Johnson report. Dr. Brownstein, good morning. Good to see you.
Yeah, you too, Kara.
All right, so if the Johnson & Johnson booster did get approved, it could give an additional shot to more than 14 million people who got the J&J vaccine. So how would that affect the number of breakthrough cases for those that did get that vaccine? And what does this new data from Johnson & Johnson tell us?
You know, this is really exciting news, Kara. I mean, we have millions of Americans that got that J&J shot and have been waiting for the path. What is the next step? Will they need another dose? And what we're seeing here is that that second shot given 2 months after the primary dose had real impact, 94% against symptomatic disease, 100% against severe illness. And when you look into antibodies, it was about a 4-fold increase. And so it really shows that it could have a significant impact on breakthrough cases. And this is data that's not surprising because this is the 2-shot regime is what we have already for the mRNA. And I should mention that they also have data on 6 months. And in fact, 6 months looks even better. And so longer wait times between those shots actually could improve response and add in that additional protection. And so at this point, I think we have a growing body of evidence that a second shot is going to be important. Now it's going to be up to the FDA to figure out when and how that happens.
Okay, you just mentioned the people who got the J&J shot more than 6 months ago. Any reason to be concerned?
Not at all. I mean, the single shot is still showing incredible protection. Immunity is not waning, but, that additional shot could help. But immunity is not a cliff. At 6 months, it doesn't just drop off. We know that, potentially 8 months could be better. And so we have to see the data. The data from J&J was by press release. We have to see more of it. The FDA will make a decision, but everyone should still be reassured that these vaccines are working well for what matters, which is severe illness and death. But that additional shot could be helpful for the future.
The U.S. surpassed that grim milestone yesterday, the COVID death toll topping more than that of the 1918 flu pandemic. A year and a half into this pandemic, what does that say about how this time will be remembered and looked at in history?
Yeah, it's amazing to me that, if you had asked me in 2019 if this would be the deadliest pandemic in American history, there's no way that I would have told you that. And unfortunately, that with all the medical achievements and vaccines, we are seeing, an incredible death toll. And I think, unfortunately, we're going to see some lessons learned, a lack of acceptance on basic things like social distancing and masking, a false sense of security among the young, and of course, a reliance on unproven treatments. And this is unfortunate because at the same time, we've had amazing science, treatments that have come, a vaccine that is beyond what we could have expected. 1918, they didn't have any access to this. They would have all, hoped for a miracle treatment, which we have. And so on one hand, we're going to see, incredible science. On the other hand, it will be looked at as somewhat of a botched response.
Yeah. Well, there is some uplifting news. Why don't I take us there? Pfizer actually announced a decreased dose of their vaccine is safe and effective for children ages 5 through 11. We've been talking a lot about this now. You work at a children's hospital. What does this news mean to you? And also, what are you saying to parents who may be hesitant to get their children at that age vaccinated if it does get approved?
Yeah, no, this is really exciting. Of course, for me at a pediatric institution, this is all what we're hoping for our patients. I also have a 10 and 11-year-old. I am excited for them to get the vaccine when it's approved. And this is in a time when we're seeing the most numbers of kids in hospitals. So this vaccine can't come soon enough. But, we're hearing different timeframes. The FDA still has yet to receive the data, and they want to be incredibly deliberate. They want to look at the data, and we should all expect the FDA to take the time to make sure that that risk benefit is there. And, so they're going to take the time they need. It could happen end of October, but it could also happen later in the fall. I think for parents, I think they should be reassured that the FDA is the stopgap here that is going to make sure that this vaccine works well. And we're hearing signs that it's effective and it's safe, and, making sure that that risk benefit is super clear. So yes, there are a lot of parents that are in that wait and see category, maybe, up to 40% right now, which makes sense. They have to see the data, they have to be reassured, and they have to have important conversations with their pediatricians. But I fully expect that these vaccines will be safe and effective. And finally, all our kids will see that vaccine like their adult counterparts already have.
That's such good news. Well, not only are you our ABC doctor, you are also a part of our ABC News Live family, and we want to wish you a very happy birthday, Dr. Brownstein. Thank you for always answering our questions, getting us through the pandemic. You like this? Yes, this is in reference to the pillow that always sits behind you on your couch, the Fauci gang. You are the Brownstein gang here. Happy birthday. So what are you going to do to celebrate?
I don't know, probably maybe not read COVID news for a few hours.
There you go. Well, have a beautiful day. We sure appreciate you,
so
John.
Much. Appreciate it so much. Have a good
All right.
one. Hi, everyone. George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel. And don't forget to download the ABC News app for breaking news alerts. Thanks for watching.